Um, about 20, 25 feet of water. I was ascending to the top. I'd reach down to get the fish closer to my left hand to be able to hand it to the boat. And shockingly, something grabbed my hand. I kind of pulled back and then pushed forward. Obviously lost the fish and never saw the shark that attacked me. Wrist. So obviously that was a concern. Swam back to the boat, and the whole rescue started from then.
So the shark bit you on your left wrist?
Correct. The left hand. I believe that my hand was all the way into the shark's mouth by the lacerations that came up the forearm.
The pain must have been just horrendous.
Surprisingly, it wasn't horrible. It was more of a shock that you could see, you know, inside the skin to the muscle. And I learned it was tendons from the doctors, but I thought it was bone that my arm was broken. I was thankful I could see my fingers, but yeah.
So you're in the water.
Mm-hmm.
A shark has just attacked you or bitten you on the wrist. Do you climb into the boat, or explain what happened after that?
Yeah, so the boat was about 10 feet away. My dive buddy had already alerted the boat that I had speared a fish and I was swimming towards it. So I was about there's a bracket on the back. I was able to swim up onto the bracket between the transom and the engines. And then the couple guys that were on the boat helped me to lay down in the back of the boat then. We wrapped it and we drove back to Grand, which is about 45 minutes away.
You were in a boat and it took 45 minutes to get back to shore?
Correct. Yeah, we were offshore.
What happened then?
So there's a clinic in Grand Cay. It's a very small island. There's about 250 people that live on it, and they provided the emergency care that they possibly could. They're not equipped for a wound like this. I think antibiotics maybe. Not even sure if they had any pain medication, but they wrapped it. They took off the rude bandage that I had, and they wrapped with gauze, and then we started trying to make plans to get back to the United States. Fortunately, there was someone that had a plane on Big Grand that offered to fly me home, and from Grand to Stewart, Florida was the closest route, so we flew here. I was trauma hawked to the hospital where I met these fine surgeons who took great care of me. Dr. Pascal and I didn't get a chance to meet, but I immediately recognized her voice. It's kind of hectic in a trauma unit, as you can imagine. She was a calm, steady voice in control of everything. I remember her getting the pulse in every finger to make sure vascularly everything was good. And I was cleared for surgery and immediately rolled into surgery. I believe that was about 4.5 hours of surgery.
Yep.
And,
You had surgery the same day that you were bitten?
I did.
You say you were flown to Stewart,
Mhm.
then you were taken by trauma hawk to this hospital?
Correct.
Okay. What was the date of the incident?
August 15th.
Okay.
That's
Where are you from, sir?
16th, sorry, August 16th. Riviera Beach.
You're from Riviera Beach?
Yes.
What do you do?
Medical sales.
You sell pharmaceuticals or medical equipment or?
Devices. I sell products for female stress urinary incontinence. Female stress urinary incontinence.
Getting back to when you were bitten, so you had to then swim back to the boat. That must have been a frightening situation, knowing that there's blood in the water. I can't get out of the water immediately. What was going through your mind?
Get to the boat. Yeah, definitely everything I possibly could to get to the boat. Fortunately, my legs were fine, so I was able to move there with my legs and kind of got on with my right elbow.
Were you trying to
pulled
hold your hand out of the water so there wouldn't be more blood around?
I was, yeah. So I was holding it above the surface. The attack happened right at the surface. But normally when you spear a fish, you're looking to make sure that sharks are around everywhere in the Bahamas and anywhere around a coral head. That's where they feed. So you always look down to the bottom, and I was in that transition of looking up to locate the boat and to minimize the flopping of the fish, and that's when the shark attacked.
You were spearfishing and you had speared a fish. The shark apparently wanted that fish, and that's why the shark was coming toward you.
Correct.
Do you know what kind of a shark bit you?
So at the time, I didn't see the shark. I did not know, but my dive buddy, Eric Gavani, had mentioned that it was a reef shark. He estimated it to be about 6 feet long. It came from behind me, turned and grabbed the fish, and unfortunately got my hand as well. And then it swam behind me, and he tried to poke it away with his spear a couple times, and then it swam off with the fish, with my spear.
So you were in the water with one other person right there?
Correct.
What did he do to try to assist you?
He said that the shark was going so fast it looked like a torpedo. There was no way he could get to him preemptively. But after, he was able to jab the shark a couple times with the blunt end of his spear to try to get it to go away.
You must have feared that I'm going to lose this hand.
Yes.
How do
Yeah.
you feel that you still have your hand?
I'm thankful to God that I still have my hand and that my fingers still move.
Are you still in pain right now?
Not much. Not much. I'm healing up really well. My physical therapy will be a long ongoing process, probably 6 or 7 months. But I'm thankful.
Good.
I'm thankful for the trauma. I'm thankful for the surgeons. Thankful for the facility. It's really made a bad situation good.
What have you learned from this experience?
Well, it's interesting. My wife has asked this as well. I love spearfishing. I love the ocean. I would like to get back into the water. I don't know if there are any steps I could take to be more safe, but I will consider that. And I just would say that if I did feel scared back in the water, then I'd stay on the boat and fish for the rest of my days instead of surfing.
Will you have full use of your hand?
Yes, I believe so.
This might be more for the surgeons, but could you speak to the extent of his injuries, what you guys saw, what you had to do to prepare everything?
Yes, so my name is Dr. Alita Pascal. I was a trauma surgeon that was on call, and we get an alert and a brief message that tells us what is coming in, and I was told that we are getting a shark bite from the Bahamas with extensive injuries. So when he arrived, we noted that, the bandage, it was completely wrapped. He had a tourniquet on, and it was on for over 4 hours. And we were worried about how much, extensive blood loss he already had, him being on blood thinners, and also wanting to stop the bleeding so we could eventually let down the tourniquet to start perfusing his hand. So once he came in, he was very calm. We took down the dressing, and he had a major injury, what we consider mostly like a mangled extremity, multiple muscles that were exposed, tendons that were involved. I could see down to his bone in his forearm. At that time, with everyone being ready, I slowly brought down the tourniquet just to see if the vascular flow was affected, and thankful to God it wasn't. In that time, that's when I checked for the pulses in his wrist and also his hand. There was, though, extensive bleeding with the muscle. So we slowly put the tourniquet back up, and that's when the operating room, they already respond to the trauma alerts. So I literally just had to turn over my shoulder and say, get the operating room ready, and they already knew once I took down the dressing that was going to be the next move. I also called our plastic surgeon because of how extensive the injuries were. I knew that it was going to be a complex repair. My job as a trauma surgeon is to stop the bleeding, but when it's something that complex, multiple tendons involved, muscles, we have a plastic surgeon that's readily available. He came right to the bedside in the trauma bay, and he escorted the patient with me to the operating room.
Describe the surgery that you did.
So once we got into the operating room and we got him intubated and got the arm prepped and draped, at that time we let down the tourniquet slowly, and I was able to handle all the bleeding that were coming from the muscles. And again, I checked the arteries and veins, everything was good. The plastic surgeon at that time, with my assistants, we looked at all the tendons, and it was a very complex repair of at least, I believe, like 8 tendons that needed to be repaired in his forearm. There were also some smaller tendons because the shark had another bite towards the wrist. So there were some smaller tendons that were also lacerated in the hand that required repair, I believe another 4. So it was an extensive surgery, took a very long time, but it was very successful. He was able to get out of the hospital the next day, which is amazing.
Yeah.
We made sure to treat him with antibiotics that were specific to bacteria for the ocean. And I'm just happy to see this recovery process and that we were able to restore his function of his hand. As he stated, he will need some physical therapy, but he's gonna be amazing. If he wants to go back and do it again, he will be able to, which is a blessing. So,
Was he bitten once or twice?
to be on it, on the forearm there was a large laceration going across here, and then there were multiple small bites here. So I do believe that he was bitten at least twice, more like 3 times. From what I could see, it was an aggressive injury to his forearm in his hand.
Doctor, you're the plastic surgeon, I
No,
gather?
I'm the trauma medical director.
Okay, were you part of this team that worked on this individual?
Well, I'm the head of the team in this hospital. HCA Florida Lawnwood Hospital is any moment they can take the patient. We provide all the resources and all the subspecialties that can help patients like this case. We receive multiple patients every year, whether injured from water activities, jet ski accident, shark bites, swordfish last year. Okay. Also, we get multiple injuries related to alligator. We developed all the expertise to handle that type of injuries. The type of surgery that Eddie needed was so advanced. He needed a microscopic repair for all the tendons in order to restore all the movement and sensation in his hand. And because, as you might know, like if there is a damage to the small blood vessels or small nerves, he will keep his hand, but it will lose the function. And that's not our goal. Our goal is that our patient recover completely from his injuries and maintain all the functionality, and he goes back to his life like a normal person. The type of surgery he got was a little bit extensive. It took 4 to 6 hours, and there was a complete repair for each tendon. There was some tissue loss that we were able to approximate and repair, so it doesn't affect the shape or the function of the hand. And we were able to treat him with a special antibiotics, as Dr. Pascal mentioned. The type of infections related to shark bites and water is a little bit different than the regular bacteria that causes infection in normal people. Some of them can develop to a serious ones that they call them on media, like a lot of times we hear flesh-eating bacteria. That's happened a lot in that type of injury because the type of bacteria is so it's considered very dirty injury and a dirty wound. What made his case more complicated is that he's on blood thinners, so the amount of blood loss and on the scene and after was also an issue, and we were able to provide him with all the blood products that he needed to doesn't affect his repair. When a patient like him on blood thinners and you take them to the OR and you try to approximate the tissue, sometimes they develop a bleeding from that area that affect the repair, and that's where the microscopic surgery play a role to prevent that from happening. So it was a case like completely successful in his care, and he was able to leave the hospital within 24 hours. I was impressed by that.
It was remarkable.
Yeah, because I mean, like 24 hours for that type of injury is it's a success for us.
Yeah.
What would you say is the long-term outlook then for his hand and his arm?
I believe that he will have a full recovery from this accident. I think he will be able to go back to his normal life using the hand and his like driving, writing, and do the basic activities for him. And even he can go back to his hobbies like spearfishing.
Like what?
Like fishing and all the activities, yes.
Were some of the shark's teeth still embedded in his hand or arm?
We didn't see that, no.
Okay. Did he have one operation and that's the only
One
surgery?
operation, and that was, yeah, but it and anesthesiologist.
Okay. So there were 2 surgeons operating on him that day, and it was
Yes.
about 4 to 6 hour operation.
Yes.
Okay. So, and overall, what do you think of his recovery from this?
Again, I consider that's a success for us. I have seen some injuries that you have to think about the shark bite injuries as like it's 3 types of injuries that the patient will develop. Number 1, they lose a lot of tissue resulting from the bite itself. Then the bite and being in the water introduce the infection to the area. So we as surgeons, we have to remove the tissue that harbor the infection. So that's increased the tissue loss. The third thing is that the patient, sometimes they lose the nerves or blood vessels. So even though that you maintain some of the tissue here, the tissue become necrotic or gangrenous and it fall apart. So in his case, we were able to prevent all these factors and we get his hand to have full recovery.
So it's a extremely good outcome for Eddie.
Yes.
Why was the decision made to come to HCA here? If you landed in Stewart, you were just as close to West Palm. Who made that decision and why?
Well, I think this is the closest trauma
Okay.
hospital.
Yeah. So the Trauma Hawk, they have like regional areas, and
Okay.
according to the map, they decide to take the patient.
It's the location.
It's other
Okay.
location, yes. And we have a big catchment area. We serve Treasure Coast starting from Hope Sound and southern part of Martin County till Melbourne, and from the water, like from the beach to the west, all the way to the end of Okeechobee County.
Okay.
So that's all our catchment area. So any accident, any injury that happened in this area, we are the main trauma center
Gotcha.
that serve.
Did you say you were flown by helicopter from the Bahamas to here and then another flight?
Airplane from the Bahamas to here, and then helicopter trauma, the trauma hawk from Stewart Airport to here.
Dr. Pascal, have you ever worked on a shark bite before?
Yes, I have, but his is the most extensive one that I've worked on, yes.
People are probably gonna see this and say, why would you feel like I wanna go spearfishing again? Why would you wanna do that?
So I think that it's thought about this question actually. Some people, even friends of mine, love to hunt, and I don't think they would stop if they had an injury when they were hunting. You know, to me, this is, you know, being in touch with nature, God's creation. I love being in the water. It's absolutely beautiful. It's very calming. It's relaxing, despite my most recent adventure. I've been doing it for years, and I just absolutely love it. I'd love to get back in the water.
Back to the Bahamas?
Yes, sir. Most definitely.
Were you snorkeling or did you have scuba gear on?
Snorkeling,
Okay.
yeah. In the Bahamas, you can't harvest fish with a tank on.
Oh, I didn't know that.
Yeah. So you have
Had
to
you been
free
in the
to.
water that day for quite some time and you were just getting ready to wrap up, or had you literally just gotten in?
I was in for about an hour and a half. Yeah.
Did you see sharks swimming in the vicinity?
Yes.
So you didn't think maybe I need to move closer to the boat, or let's get out of the water for a while?
So we normally, if we see more than one shark, we'll normally get in the boat and move to another coral head, half mile, a mile away. I think the sharks have learned that when they hear a boat engine, they follow that. They definitely, if you spear a fish or if you hit a rock while you're spearing the fish, it's like the dinner bell for them. They come. So there's like a mental clock that goes off in your head. You kind of want to be out of the water in about 30 seconds after that happened. And maybe either the shark arrived too soon or too late, but
So did you say you'd speared a fish? Were you then making your way to the boat?
Correct.
You
Yeah,
were.
I was coming right to the surface with the boat. I'd transitioned from looking down to looking up out of the water for the boat.
Do you mind explaining once again how this happened?
Sure. I'd speared a mutton snapper down in the Bahamas. About 20, 25 feet of water was the depth of the coral head. As I was swimming to retrieve the fish, I pulled it close to this hand. I was swimming up to the surface, and as I transitioned to look up for the boat, something hit my hand. I opened my eyes, I couldn't see anything. I pulled back and then pushed forward. At that time, I realized that my arm was hanging down at about a 45-degree angle at the wrist. I could see flesh. I said, oh, this is not good. Swam to the boat, and my dive buddies, Angelo and Perry Gavani, helped me back on the boat.
All right. Anything else we haven't touched on that you think you'd like to put out there for the public?
I'd like to say that I really, 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 from the bottom of my heart, appreciate the care that I received here at Lawnwood. It was fabulous. From the very, very start, I mean, this was the calming voice. It's kind of hectic, as you can imagine, in a trauma facility. I saw a lot of faces. Are you okay? You know, this, that, and the other. And Dr. Pascal's voice was in control, calm, smooth. I just knew that I was in great care.
I have a question. I know I'm kind of late to the party, but I've covered shark bite stories before, and I guess it's a question for a physician or a doctor. But from my understanding, they've said previously that when sharks bite people, it's normally like a mistake. They're not trying to eat humans. So would that kind of still apply to this scenario? Can you just kind of explain your research or what you guys have been seeing?
I mean, he speared a fish, and the shark is going for the fish. Unfortunately, he got his forearm, and so I would agree with you on that point. But we're here in case those happen, where a shark mistakes a fish for a forearm. We're here to help these patients, and I'm so happy that we were here to help Eddie. He's an amazing guy. He speaks about my calmness, but he was just as calm, despite him being on blood thinners and the blood loss. And that's what we're here to do as trauma surgeons. So,
How much blood do you think he lost?
I would say close to a liter at least, minimum. So that's a significant amount of blood.
And how do you feel about his recovery?
I think it's amazing. I haven't seen him since that day. So to see him today, I just think he's a miracle. And I'm just proud of, the team. I'm proud of us here, the work we do, and I'm proud of him. He's making a good recovery, and we did the initial work, and now he's having to do the recovery process, and I think he's doing amazing. To see his function in his hand today, I'm just in awe.
I'm checking his fingers moving. I mean, that's a miracle.
Yeah.
Because all the tendons and the blood vessels are responsible on the movement of the fingers, and that's the best outcome we can get
Yes.
out of his injury.
Are you able to move them all your fingers?
Yes.
Can I see?
Yeah.
Were you diving on your own boat? Do you own a boat?
Yes.
So had you left, I don't know, Jupiter or Riviera Beach on your own boat and went to the Bahamas?
Correct.
Were you planning to be there for several days, or was it just a day trip?
Yeah, it was Friday, Saturday, Sunday, 3-day trip. We got cut short. It was Saturday, unfortunately.
So how many people were there with you?
4 of us. Yeah.
The 2 people who stayed on the boat and 2 were in the water?
Yeah, sometimes it's 3 in the water and just 1 driving, but at this moment, there was just 2 of us in the water.
Okay. By the way, what's the name of your boat?
Square grouper?
Okay. Is that in a place where we could see it somewhere? Or do you have a picture of it?
I do.
Okay. All right, maybe we can get a picture, please.
Sure.
Okay, thank you.
What was the date of this incident, the shark bite itself?
It was August 16th.
I think you mentioned earlier, but you're gonna keep getting back in the water, right? Like,
Yes.
this isn't gonna stop you?
Correct.
Cool.
Very resilient.
Do you have any advice for other people who may be spearfishing who could hopefully avoid the kind of incident that happened to you?
Avoiding an incident. Be conscious of sharks in the area. be conscious of barracudas in the area. Have a tourniquet on your boat. Have a way to contact emergency care, whether that's a satellite phone or some other phone. It's a little tenuous when you're 45 minutes or an hour offshore and you have no way to contact anybody.
Is there anything you would do differently if you could repeat what happened, or is there anything you would do differently?
I don't think I'll keep the fish as close to my hand as I did from now on. I might give it a little leeway.
Was the fish on the end of a spear? Is that correct? Or you were just holding it with your hand?
So the spear has a leash. The tip goes into the fish if you shoot correctly. And there's a leash that's attached to the spear. So in order to stop the flopping, you want to bring the tip and the fish as close as you can, really to your body, into your hand. And the shark wanted it more. So
In the future, you would hold the fish with your hand further from your body, or I'm not sure I follow totally.
might just hold the spear and everything. The spear's about 8 feet long, so I'll hold it all down there.
You said the shark ran away with the spear?
It sure did.
So how does it get rid of the spear? Is it dragging that spear around?
It might be. Might be a bad piercing.
It might-
I've seen fish hooks in, but I haven't seen spears in too many sharks' mouths.
Do you feel like you and the shark got a story to tell?
Mm-hmm. Most definitely.
How long have you been spearfishing?
My whole life, 30 years, 35 years.
Ever have an incident similar to this, or anything close calls?
Yes. Yeah, we've had close calls before. We had the group. We've had sharks bump into, take fish off the spear. If a shark gets caught in the coral head, like in a hole, oftentimes they'll beat you to the fish. If you have to come back to get another breath of air and go back down, a shark will be able to get it before. But rarely do they even care about humans. It's pretty rare.
So you've never been bitten or?
No, my first bite.
Hopefully the last.
Yes.
Okay. Thank you very much.
Thank you.
Thank you.